Hi everyone, thank you for watching this presentation today. This presentation is about how to transition from the health insurance marketplaces to Medicare. Let's begin with the learning objectives. At the end of this presentation, you will be able to review Medicare coverage and enrollment basics, understand how the health insurance marketplaces affect Medicare, and know when to enroll in Medicare if you have coverage through the health insurance marketplace, such as a qualified health plan or Small Business Health Options Program, or SHOP plan. First, we'll review some Medicare basics. So you may be wondering, what is Medicare? Medicare is a federal program that provides health insurance for those 65 and older, those under 65 who receive Social Security Disability Insurance, SSDI, for a certain amount of time, and those under 65 with kidney failure that requires dialysis or transplant. It's important to note that there are no income requirements for Medicare. There are two ways that you can receive your Medicare benefits. One way is through Original Medicare, the traditional program offered directly through the federal government. And the second way is through Medicare Advantage, which refers to private plans that contract with the federal government to provide Medicare benefits. When talking about Medicare, you might hear people mention the different parts of Medicare, and this is because Medicare benefits are administered in three parts. Part A is the hospital or inpatient benefit part of Medicare. Part B refers to the doctor or outpatient benefits, and Part D is the prescription drug benefit. The reason it's important to know about these different parts of Medicare is because you access them in different ways depending on what type of Medicare coverage you have. So, for example, Original Medicare, the Medicare through the federal government, includes Part A, the hospital benefits, and Part B, the doctor outpatient benefits. If you need prescription drug coverage, then you'll be getting your Part D prescription drug benefits through a standalone prescription drug plan, sometimes called a Part D plan. Medicare Advantage, also called Part C, is a way to get Parts A, B, and D through one private plan. Some acronyms you might be familiar with already are HMO and PPO. Medicare Advantage plans are administered by private insurance companies that contract with the federal government. And it's important to note that Medicare Advantage plans are not a separate benefit, but rather just a different way of accessing your Medicare benefits. So if you have a Medicare Advantage plan, you still have Medicare. So we'll move on now to talking a little bit about Medicare enrollment, which is important to be familiar with before we talk about transitioning into Medicare from the marketplace. So one way of enrolling in Medicare is through automatic enrollment. You will automatically be enrolled in Medicare and mailed a Medicare card if one of the following is true. So if you have already enrolled to receive Social Security benefits before you turn 65, if you have a disability and you've been receiving Social Security disability insurance for at least 24 months, or if you are getting SSDI because you have ALS. And this is because people with ALS are automatically enrolled in Medicare the first month that they receive their disability benefits. So if you're not automatically enrolled, then there are sort of three first-time enrollment periods that you'll want to use. These are the initial enrollment period, the Part B special enrollment period, and the general enrollment period. The initial enrollment period is a 7-month period, including the 3 months before, the month of, and 3 months following your 65th birthday. When your Medicare coverage starts depends on when, during your initial enrollment period, you enroll. We usually recommend enrolling in the 3 months before you turn 65 because then your Medicare benefits will begin on the first of your birthday month. If you missed your initial enrollment period, you may still be able to enroll in Medicare using the Part B special enrollment period if you qualify. The Part B special enrollment period, or SEP, starts when you have coverage from current work which we also sometimes call job-based insurance, and you are in your first month of eligibility for Part B. This enrollment period ends 8 months after you lose coverage from current employment because employment or insurance ends. Using the Part B special enrollment period means that you'll not have a late enrollment penalty for having delayed Medicare enrollment. And it's important to note that the Part B special enrollment period only applies if you have coverage from current employment. So things like retiree coverage or COBRA do not qualify you to use the Part B special enrollment period because those are not considered coverage based on current work. Lastly, we have the general enrollment period, or GEP. This is an enrollment period that you would have to use to enroll in Medicare if you missed your initial enrollment period and you don't qualify for a special enrollment period for Part B. The general enrollment period runs January 1st through March 31st of each year, but coverage does not start until July 1st of that year. It's also important to know that you may have to pay a 10% Part B premium penalty for the rest of your life for every year that you delay enrollment. For example, if you delay Medicare for 2 years and then enroll using the general enrollment period, then your Part B premium would be 20% higher. So those were some of the Medicare basics that you need to be familiar with before we start talking about the transition process. We'll now talk about the marketplace. So health insurance marketplaces are forums where uninsured or underinsured individuals and also businesses can shop for health coverage. Marketplaces are sometimes known as exchanges or by state-specific names. And relatedly, some states created their own marketplaces, whereas others use the federal marketplace. There are a couple of types of insurance offered through the marketplace, including qualified health plans, which we'll refer to as QHPs throughout this presentation, but sometimes they're also called marketplace plans as a shorthand. And you can also purchase Small Business Health Options Program, or SHOP plans through the marketplace. Marketplaces allow you to compare available plans based on price, benefits, services, and quality. When you're becoming eligible for Medicare or you already have Medicare, it's important to know that no type of Medicare coverage is sold through the marketplaces. If you are already enrolled in Medicare, then you generally do not need to change your health coverage, and you do not receive coverage through the marketplaces. So if you need to purchase a Medicare Advantage plan or a Medigap or a Part D plan, you don't use the marketplace for that, you go through Medicare. So let's talk a little bit more about one of the types of coverage you can get through the marketplace, the qualified health plans, or QHPs. Qualified health plans are private health insurance policies sold on health insurance marketplaces. As I mentioned, they're also known as marketplace plans. QHPs meet protections and requirements set by the Affordable Care Act. For example, they follow federally established cost-sharing limits, and they provide what the Affordable Care Act set out as essential health benefits. Another important characteristic to know about QHPs is that individuals may qualify for tax credits to help pay the QHP premium. So how do QHPs and Medicare relate to each other? The answer is that QHPs are typically not for people with Medicare, and it is illegal for someone to sell you a QHP if they know you already have Medicare. Additionally, in most cases, people with Medicare are ineligible for cost assistance, those tax credits we talked about on the last slide, to help pay the QHP premium. So keeping a QHP in addition to Medicare, whether that happens by mistake or for whatever reason, would usually mean that you owe the full cost of the QHP premium, which tends to be expensive. Of course, in the world of Medicare and health insurance, there are always a couple of exceptions. And so I want to take a moment just to point out that there is an exception to the rule that you don't qualify for tax credits once you have Medicare. If you pay a premium for Part A, or you are eligible for Medicare due to end-stage renal disease, kidney failure, also known as ESRD, you can continue receiving premium tax credits for your QHP, but you should still consider the other consequences of delaying Medicare enrollment, which we will talk about in a moment. So there are sort of three main consequences to staying enrolled in your QHP and delaying Medicare enrollment. One is Medicare late enrollment penalties. Another is gaps in coverage. And a third consequence is coordination of benefits problems. So first, let's look at late enrollment penalties. For each 12-month period you delay enrollment in Medicare Part B without insurance from your or your spouse's, or sometimes a family member's current work, you will have to pay a 10% Part B premium penalty. This premium penalty gets added on to your Part B premium. So for example, someone who delays Part B enrollment for 5 years pays a 50% penalty, and their premium, if the premium this year is $148.50, that individual would end up paying $222.75. They're paying 50% more on top of their existing premium. Another consequence of delaying enrollment is having a gap in your Medicare coverage. As we learned earlier, there are only certain times when you can enroll in Medicare for the first time, and outside of those special occasions when you can enroll in Part B, you are limited to using the general enrollment period. And as we talked about, the general enrollment period is only for the first 3 months of each year, and if you use your general enrollment period to enroll in Medicare, your coverage won't be effective until July 1st of that year. So depending on your healthcare needs, you may not be able to get Medicare to start right away, and that gap in coverage can be quite harmful. A third consequence of delaying Medicare enrollment is having coordination of benefits problems. Coordination of benefits refers to the way that your insurances work together to cover the cost of your care. And the issue with keeping Medicare and a QHP at the same time is that the coordination of benefits is unclear. So there's a risk to delaying Medicare enrollment and staying enrolled in your QHP, as there's no guarantee of how much the QHP will pay, if at all. The marketplace plan might say, you're supposed to have Medicare, so we're not going to pay, or it may not realize, and it does pay, and then later it tries to take back those payments. And that's a situation that we're just trying to avoid, is having any coordination of benefits problems. So I do want to take a moment to talk about a process called equitable relief for marketplace enrollees, because it's something that can be used to help people who, made an enrollment decision or made an enrollment mistake by staying in their marketplace plan and not enrolling in Medicare. So equitable relief for marketplace enrollees is for individuals who delayed enrolling into Part B in order to stay in their marketplace plan. This includes individuals who could have enrolled in Part B using the Part B special enrollment period, but chose marketplace coverage instead. This equitable relief process helps you enroll in Medicare as soon as possible, so outside of the general enrollment period, and it can erase a late enrollment penalty that you might otherwise have had for having delayed enrollment. There are a couple of eligibility requirements that you have to meet in order to request this type of equitable relief. So you are eligible for equitable relief for marketplace enrollees if, 1, you are currently enrolled in premium-free Part A, and your initial enrollment period began between April 1st, 2013 and June 1st, 2020. You were notified of your retroactive premium-free Part A between October 1st, 2013 and June 30th, 2020. Or you had a Part B special enrollment period that ended between October 1st, 2013 and June 30th, 2020. So if you delayed your Medicare enrollment so that you could stay enrolled in your qualified health plan, and you're thinking that maybe this process could help you get into Medicare, help fix some mistakes that were made in the past, you should contact your state health insurance assistance program to see if they are able to assess your eligibility for this type of equitable relief or otherwise help you address enrollment mistakes and issues. We will talk about at the end of this presentation how to find that contact information for your State Health Insurance Assistance Program, also known as a SHIP. So that was an overview of the qualified health plans, the marketplace plans that are available through the health insurance marketplaces. We'll now move on to the other type of coverage sold through the marketplace, the Small Business Health Options Program, or SHOP plans. So SHOP plans are job-based insurance plans purchased through the marketplace. SHOP allows businesses with fewer than 50 employees and their employees to search for and buy health coverage. SHOP plans follow the same coordination of benefits rules as other insurance based on current work, and we'll go into detail about what those rules are in the next couple of slides. So your SHOP plan is either primary or secondary to Medicare, depending on the size of your employer and whether your Medicare eligibility is based on age, disability, or end-stage renal disease. First, let's talk about what it means to be primary or secondary. When you have Medicare and another type of insurance, Medicare either pays primary or secondary for medical claims. Your primary insurance pays first on a claim, and your secondary insurance pays after the primary insurance. The secondary insurance usually pays all or some of the costs left after the primary insurance pays, such as co-payments or deductibles. And if the primary insurer denies the claim, the secondary insurer may or may not make an independent coverage decision depending on the plan. So what that means is just because your primary insurance denied coverage for something, that doesn't necessarily mean that your secondary insurance will also deny coverage. It can make an independent decision, and you may end up getting coverage for that service from your secondary insurance anyway. So here's how SHOP plans coordinate with Medicare, depending on your situation. First, if you're eligible for Medicare due to age, and your employer has 20 or more employees, then your SHOP plan pays primary. If your employer has fewer than 20 employees, your SHOP plan pays secondary. If you're eligible for Medicare due to disability, your SHOP plan will always pay secondary. And if you're eligible for Medicare due to end-stage renal disease, or ESRD, your SHOP plan pays primary for the first 30 months, beginning with the month you became eligible for ESRD Medicare. So whether or not your SHOP plan pays primary will affect your Medicare enrollment decisions. If you like your SHOP plan and it is primary, so again, a SHOP plan would be primary for somebody who's eligible for Medicare due to age and their employer has more than 20 employees, you can choose to delay your Medicare enrollment because you already have primary insurance. Be sure to compare your plan's costs and coverage, though, to Medicare's and make the decision that is best for you before deciding to delay Medicare enrollment. If your SHOP plan will pay secondary to Medicare, according to Medicare's rules, then you should probably enroll in Medicare because your SHOP plan may pay little to nothing for your care, since it's supposed to be secondary. And one thing to note is that regardless of whether your SHOP plan pays primary or secondary, most people with SHOP coverage will qualify for that Part B special enrollment period to enroll in Part B without penalty. And so for those of you for whom this is relevant, we'll go into more detail about qualifying for the Part B special enrollment period. You qualify to use this enrollment period if 1, you have insurance from current work. This can be your job, your spouse's job, or sometimes a family member's job. Or you have had such insurance within the past 8 months. And 2, you must have been continuously covered since becoming eligible for Medicare, including the month that you became eligible for Medicare. You lose eligibility for this special enrollment period if you have more than 8 months in a row without coverage from either Medicare or job-based insurance. We should also talk about Part D, the prescription drug benefit, and how it interacts with SHOP plans. So if you have creditable coverage from your SHOP plan, you may choose to delay Part D enrollment without penalty. Part D again is the prescription drug benefit part of Medicare, and creditable drug coverage is, on average, as good as or better than the basic Part D benefit. You should contact your SHOP plan to learn if the drug coverage is creditable, and you can enroll in Part D within 63 days of losing creditable coverage to avoid penalties and gaps in coverage. If your SHOP plan drug coverage is not creditable, you should enroll in Part D when you become eligible for Medicare. And note that in order to enroll in Part D, you also have to have at least Part A or Part B in order to get Part D coverage. So that concludes our overview of Marketplace to Medicare transitions. Now let's review what you learned. First, you learned that most Medicare-eligible individuals should disenroll from their QHP, their Marketplace plan, and enroll in Medicare when they're first eligible. If you don't, you may experience gaps in coverage, late enrollment penalties, and coordination of benefits issues. Second, you learned that Medicare is primary for eligible individuals in SHOP plans if they are under 65 and qualify for Medicare due to a disability, or if they are over 65 and their SHOP plan is through an employer with fewer than 20 employees. You also learned that Medicare is secondary for eligible individuals in SHOP plans if they are over 65 and their SHOP plan is through an employer with more than 20 employees. If you would like individualized counseling and assistance with your Medicare choices and coverage, you should contact your State Health Insurance Assistance Program, or SHIP. You can visit shiphelp.org to find your local SHIP. And note that your SHIP may go by different names depending on the state that you live in.